We're learning new details tonight about an admission by the Missouri Department of Health and Human Services. It combined data from different types of COVID testing, which made the percentage of positive tests appear smaller. Thanks for joining us tonight for KCTV5 News at 10. That new information posted on the department's website today. In the statement, the department says it was following guidelines that were laid out by the CDC, but says it'll be taking a different approach moving forward. Here's what's at issue. The state says it's been conflating or combining the results of both tests that tell if a person is currently sick and the results of antibody tests, which are supposed to indicate if a person has ever had the virus. Yesterday, Missouri reported about 6.5% of tests conducted in the state were positive. But after separating the two types of tests, viral tests came back with 8.6% positive results, while antibody tests were low at 4%. That caused the number of actively sick people in Missouri to appear lower than it actually is. The DHSS also admits the data is misleading because if the person takes both tests, each test is counted while the illness is only recorded once for the individual. The Missouri Democratic Party says that makes the state appear as though it's conducting tests on more individuals and finding fewer positive results. Now they say they've caught the state in the middle of a lie. During a press update Thursday, state health expert Dr. Randall Williams told a reporter Missouri was not combining the data.
No, it does not include antibody testing. About 4 states have gotten in a lot of trouble because they tried to conflate their numbers, I think, to drive up their numbers, and we don't do that here in Missouri. As I mentioned the other day, we've done about 13,000 serological tests through our commercial labs, but the numbers you see are just PCR testing by our commercial and state labs.
Those other states Dr. Williams was referring to are Pennsylvania, Vermont, Georgia, and Texas. In a statement today, the Democratic Party's executive director said the Parson administration has not been fully honest with Missourians about how much testing we are doing and need to do. The lack of transparency, incompetence, and false promises seriously undermine the credibility of the governor and Dr. Williams and raise even more concerns about the state's response to the pandemic. The state says that moving forward, cases will be calculated by the number of positive cases divided by the number of people tested, not the number of tests done. The tests will also only include the results of viral testing, and antibody test results will be kept separate.